and welcome to Core Impulse. On this beautiful day, I'm Beatrice Kruger. Today's program is a very gentle sequence of knee exercises which you can do if you are unable to lay on the floor. So you can sit or stand, and this will actually really help you if you have a knee problem, if you're just after an operation, or if your knee feels really tight and not very flexible. So we're going to use something to sit on. You can also do it on a sofa, for example. If you have a sofa where you can place your leg like that would work. Or you need another chair or some furniture. I'm using a softball and also a bit of a firmer fitness band. These are going to be the tools to be used in this program. So the easiest way to stretch your leg, the back of your leg, your hamstring, is just to place your foot on a furniture or chair. And it is very important that after an injury, after an accident or after an operation, you need to be able to stretch that leg again. That will say, the doctor will emphasize this. So for you to stretch the leg again, to learn the leg to be stretched again, you can just apply pressure on the thigh. So as you press down, you flex the foot, you'll get a really nice stretch on your hamstrings and on the back of your leg. Try to sit nice and straight so you're not slumping. So you're leaning forward, and I would suggest you do this about a minute. Your doctor will tell you this is very important, otherwise you will have problems walking if your leg isn't straight again. So after you've done that, we're going to go and take the fitness band, wrap it around the foot, cross it over, and we're just going to take it quite firm. And as you flex the foot and as you pull, you can now give your calf a really good stretch. Then we're going to exercise the foot at the same time, so we're going to point the foot and then flex. Make sure when you flex you're very gentle, you don't let it come back too quickly. And I'd say you do this about 12 times. So you're getting a stretch in your calf and a bit of mobility and strength in your foot. The feet are very important, by the way, for really healthy knees. If your feet are pronating or supinating, then it's difficult to have your knees properly aligned. Fabulous. We're going to come back. We're going to take this quite short. We pull it in, we pull our elbows back, and now we're going to track the knee. This will strengthen your arms, by the way, and will strengthen your leg. And this tracking motion is really important because it will increase the synovial fluid and help your leg to be aligned and add some strength. If you want to take it a bit firmer, your arms have to work harder, and then your leg has to work harder. So like I said, you need a stronger TheraBand or a stronger fitness band for that. And again, you do this about 12 to 20 times. I would also use it on the other leg as well. It's important that you practice on both legs. Next thing is we want to stretch the kneecap. So we're going to apply pressure. We're going to push the kneecap down gently. Try to keep the knee quite loose as you do this. So you're pushing down, applying pressure to those trigger points, and then pushing the kneecap up again. So pushing it up and down. A very healthy kneecap will move freely. And then you can also try to move it from side to side, which will just be a lovely stretch for this poor old kneecap. And then you can apply pressure all the way around with your fingers, with your thumbs. Try to loosen up any tight spots. I find that works much better using your fingers than if you're using any sort of fascia tool. So you do this for a few minutes, trying to move that kneecap, talk to it, give it some love. Yes, lovely kneecap. Wonderful. Remember, we have also the liver and spleen meridian runs on the inside of your leg and the gallbladder meridian on the outside of your leg. So improving your digestion will really help joints in general and also your knee joint. So not too many sweets, not too much milk products from cows, from industrial farms, and also eating a lot of vegetables. Eat well. You know, for good joints, you need to eat well. There's no other way around. So, having said all that, we're going to try to strengthen. We're going to go and just, by the way, just kind of moving your legs like that will help again synovial fluid to remove any particles in your knee. Movement is everything. Your joints are destined to move. Remember that. And then we're going to go up, flex the foot. This will now work your quadriceps, yeah? And up and flex and point. Quite a good exercise and easy to do. And lift and do this about 12 times. Do it on the other leg as well. Yeah? I'm going to do one more. And up and flex and point. Keep smiling. So having done all that, we're going to now try to work the inside of our legs. Now the inside muscle is usually the weakest because we usually use more the middle and outer part. So this strengthening this middle, also inside part is very important, that the knee is placed in a good position. Yeah, otherwise it comes off track. You can also remember the quadriceps, a bit like a coach with 4 horses. The horses have to all go in one direction. If one goes to the side, the whole carriage will come off the track. So this is a good vision. So we're going to squeeze the ball. Squeeze the ball. This will help the inner muscle, inner thigh muscle, to become stronger. You can squeeze quite firmly and do this about 12 to 20 times. If you turn the heels out a bit and squeeze again, this will then increase using a bit of a different part of the inner leg. So you're just turning the heels a bit out and squeezing again until you feel a bit of a burn on your inner thigh. Very nice. Now, we're going to take our firmer, I'm going to go a little bit more over here so you can see me on the floor. I'd like to show you a really nice exercise to learn how to align your knees properly. Yeah. So we are going to stand. We're going to take the shorter part of the band is on the outside of the foot. We're going to place our foot on it, taking it quite firmly, wrapping it around like a spiral. Takes a bit of practice, bringing it around to the other side. Sometimes it's easy if somebody can do that for you. Make sure it's not too curled up. Yeah. It comes over the upper thigh. You're going to stand up, taking it over your buttocks, and then taking it to the other hand. Yeah. So you're now wrapped up in this, and this signifies the outer rotation of the upper thigh, and the lower leg rotates in. So this way it gets more stability into the leg. You're going to hold on to this chair, yeah, and then you're going to try to stand on this one leg, and we're going to do some small knee bends. So your knee is supposed to be looking always in the direction of your second toe. If it starts to rotate in, try to really focus it on the second toe. So you're going to do this exercise for about 20 times, yeah? And afterwards, you can also do very small movement. It doesn't have to be a big bend, yeah? So you can do it very small. Make sure that kneecap is pointing towards the second toe. Repeat this on the other leg. So remember, the shorter part of the band is on the outside of the foot. You wrap it inside like a spiral around, holding it in the other hand quite firmly. As you're letting it go, you will find now this leg is feeling much lighter. Yeah. So we want to really align our knees to our hip. So we don't want to, as soon as your feet pronating in, see what happens to your kneecaps. They're looking to each other, which is really bad. So as you're placing your foot properly, remember a little air bubble under your sole of your foot or under the arch, and then automatically your knees will be aligned to your hip over to your second toes. Very important. Foot position is everything. It's the foundation of your whole carriage. Yeah. Great. Hope this is all making sense. We're gonna finish off with some releves. Take the softball. You're gonna take it between your ankles, and again align yourself. Make sure your feet are not moving in or out, and we're just going to lift up, squeeze the ball, and release. If you want to, you can add a little squat, and up, squeeze the ball. This will also activate your inner thighs, yeah? Looking cheerful. And down, squeeze, yeah, do this about 12 times. Up, and perhaps you want to do a balancing. So you're going to stay up there, yeah? I'm having a bit of a crooked toe, so I'm a bit wobbly. And then balancing, this will also working your legs really well. Having a crooked toe from the ballet dance I used to do. So here we are. I hope you enjoyed this program. I hope I gave you some inspiration on how to work your knees and legs in a very efficient but gentle way. Thanks for joining me. If you're enjoying my program, I would love you to subscribe, and I see you again soon. Take care. Bye.